Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the nursing editor for Health Leaders. Today, we are speaking with Robbie Freeman, who is the Vice President of Digital Experience and the Chief Nursing Informatics Officer at Mount Sinai Health System, about the 5 rights of AI in healthcare. So, hi, Robbie, how are you?
Hey, doing great. Great to be here.
Yeah, thanks for jumping on. So let's get right into it. Obviously, AI is a pretty hot topic right now in the world of nursing. So what do you think are some of the main concerns about AI entering the healthcare workforce?
One of the things that I think will be important as we start to see AI make its way into, patient care, is that our care team members, our nurses, have a seat at the table and that their voice is included in how we both design, these AI products, understand how they work, and then implement and ensure that it's a seamless experience. What we don't want is something just handed down or designed kind of in a silo without feedback from our nursing team. So, at the Mount Sinai Health System, we have developed a number of internal AI products, and we have a portfolio. And we always take what I call a co-design approach, meaning that we're sitting down together at the table, our data scientists, our engineers, our
Mhm.
frontline team members, and designing these products together. And that really is key to success. The other thing is some of our best ideas come from our frontline team and our nurses. So
Mhm.
anyone in our organization can submit a request for an AI, concept or idea, and we have many examples where the frontline team has, sent us an idea. We would scope it out together. And where it makes sense, we would partner, develop, and bring it to life. And so I think when you do it the right way, there's a
Mhm.
lot of value that we can unlock. And it can help us both reduce the burden of documentation and also improve our ability to keep patients safe,
Mhm.
deliver a high quality of care. And so I think when done in the right way, we can do a lot, but we want to make sure that the key is kind of having our the nursing voice at the table along the way.
Absolutely, yeah. And so, speaking of implementing it the right way, talk to me a little bit about the 5 rights of AI in healthcare framework and how did that come to be? What's the goal?
Glad to. So, a couple of thought leaders in this space. I have to give a shout out to co-authors, Dr. Angela Ross, Dr. Kathleen McGrow, and Dr. Olga Kagan, who have worked with for many years. We came together to thinking about what are the questions that if you're a nurse leader, let's say you're a nurse manager or a unit manager, like what are the key questions you may want to ask before you start, working with an AI product? And we
Mhm.
recently published an article, glad to circulate the link in Nursing Management, the Journal of Nursing Management. And we published what we call the 5 rights. It was inspired by the 5 rights for medications. So,
Mhm.
you know, one of the key one of the key tools within nursing to ensure that we're delivering, have safe medication administration is the 5 rights. And so we took that and we wanted to look at it through the lens of AI, and we
Mhm.
came up with 5 things that we think would be important to ask. Um, and I'll just go through them briefly. It's
Mhm.
thinking about the right objective. So, like, what is the problem that you're solving?
Mhm.
Making sure that that's really clear why you're using the tool and the problem that you're solving. Thinking about the approach, making sure that it's integrated into the workflow and that the approach makes sense. The right competency. So, are we using this with um, team members who really understand the why and that we've explained kind of why we're using it?
Mhm.
Not just we don't want to just blindly follow the output of an AI model because we really look at this as an augmented intelligence tool, and it's not going to ever replace our clinical decision making. The right data, so just making sure we ask questions about what data was this trained on?
Mhm.
What, was it a diverse patient population? Was it a population that looks like the patients that we care for at our organization? And also that we have the right safeguards, that we make sure that we've tested it prospectively. we understand how it works, we've checked for bias, and that we've ensured that those steps were taken before it gets used for clinical care. So that's the framework, and this was just, we tried to distill it down to some of the simple questions that we think any nurse leader should ask before they implement an AI product.
Absolutely. And so, taking all of those into account, why, I guess I want to get a little bit more into why you picked those five things and why each of them are really important when it comes to AI implementation.
Well, I think that these are some of the high level questions that we can empower our nurse leaders to ask. And I
Mhm.
think the balance is not getting too far into the weeds. I think that if this was written for an audience of, data science experts, we may get
Mhm.
into some more, technical discussions on hyperparameter tuning or, the ways things are working under the hood. But we tried to keep it at the kind of business leader, clinical leader
Mhm.
perspective to make sure we're at least addressing those big boulders.
Mhm.
Um, but I do think that organizations, as they think about their AI governance structure, they need to have teams that can do that deeper dive into the very technical kind of evaluations around the model like performance and how you're going to measure that over time and watch for performance drift and other considerations. There's an organization called the Coalition for Healthcare AI, or CHAI,
Mhm.
um, that has started to put out some useful guidelines that can help for organizations that are standing up their AI governance. So this was really through the lens of a nurse manager, nurse leader, and it's not meant to kind of replace that,
Mhm.
organization-wide overarching kind of robust governance processes that are also critical.
Absolutely. Yeah. I like the idea that it's supposed to be consumable for the average nurse leader. I think that's really important. So, do you think that this framework will address the main concerns that maybe frontline nurses have about AI? I know you were mentioning making sure that nurses are included, and I know a lot of nurses maybe have some ethical concerns. So, do you think this framework will serve to kind of address that?
I think it can help ensure that we ask the right questions.
Mm-hmm.
A- as a profession that really values evidence-based practice,
Mm-hmm.
I think that it's important for you know the nursing community to be reading the literature, um, ensuring that one of the ways that we can share how these tools are working is through peer-reviewed publication. So I
Mm-hmm.
do think we have an opportunity to take an evidence-based approach, and I do think that for our frontline nurses, especially nurses that may be prepared at the master's or the doctorate level, to really look at it, evaluate, critically, to take an evidence-based approach, to look through the literature.
Mm-hmm.
And I think when used in the right way, it can have, tremendously positive impact on our work and on our patients. Um, and so I think this will be one kind of tool to help, ask the right questions.
Mm-hmm.
But, it will be important that we take an evidence based approach and reference the literature, and let that guide kind of where we want to focus and our understanding of how these tools are working.
Absolutely, yeah. So, how do you think CNOs and other nurse leaders can implement this kind of framework into their own health systems?
Yeah, so I think that a couple of like recommendations. One is for the CNO to be asking about um, AI governance if they're
Hmm.
not already kind of fully in the loop. I would say from there, kind of making sure that you have nursing representation at the table,
Hmm.
that they're participating in the AI governance, that they have a voice in any tools, that get used at the point of care by the nursing team. And I think just like any other technology that we bring into the clinical setting, the end users have to weigh in on the safe and appropriate use. And
Hmm.
so I think the CNO plays a really important role there as advocating for the nursing team, and advocating for the safe and ethical use from the patient perspective as a patient advocate. and ensuring that they have a voice within the governance process. And I think that organizations who do that well are going to be really well positioned to realize a lot of value from their use of AI.
Absolutely, yeah. I love the idea that the CNO is kind of the go-between, to make sure that the frontline nurses are represented and that the AI governance is properly implemented.
That's right. And many organizations have chief nursing informatics officers. So the CNO has a partner there
Mhm.
that can be the voice at the table, help translate between the technology teams and the clinical teams. So I would, encourage our CNOs and chief nurse executives to, lean on their CNIOs and their
Mhm.
informatics, nursing informatics team members who can play a really important role here.
Absolutely. It's a very important partnership for sure. Um, so my last question is, do you think this framework could be applied? Obviously, it was inspired by the five rights of medicine. So do you think this framework could be applied to other different kinds of workflows or forms of technology that are entering the nursing workforce?
I think so. I think certainly it could be valuable for the multidisciplinary team, and so we have shared this with a work group with the HIMSS um, committee that's looking at AI, and so we've also published or shared electronically a more generalized, kind of broader version. Glad to share the link there as well. So, kind
Hmm.
of, other clinical disciplines can take a similar approach around asking these questions before AI products are being used within their practice. And so, I do think it can have a broader application. This article we focused in on the role of the nurse manager, nurse leader, so it's pretty like targeted. But I do
Hmm.
think it's a framework that can easily be, generalized to the broader caregiving community.
Absolutely. Well, I'm excited to see how it goes and how other health systems take this information and apply it. And thank you so much, Robbie, for your time. I'm really grateful to have had this opportunity to hear your insights. And thank you so much to our audience for listening.
Thank you.